Lead Horse Technologies is a personalized medicine company using novel health information technology to reduce the frequency and costs of adverse drug events. We do that with our Medloom clinical decision support system. Medloom applies advanced artificial intelligence analytics to millions of real-world adverse event case reports to discover patterns of patient medical profiles that are significantly linked to bad outcomes like liver failure, heart attack, or breast cancer. In other words, outcomes that result in death or hospitalization. The patterns discovered by Medloom have been clinically validated at being accurately predictive of those outcomes greater than 4 out of 5 times. Medloom stores those discovered risk prediction patterns in the cloud. Then the AI-enabled Medloom bolts onto any electronic health information system in a platform-agnostic manner to identify patients at risk for those bad outcomes. As an embedded web app, Medloom is as invisible to the clinician as Intel Inside is to the user of a computer. We developed Medloom as an embedded web app so that there would be no technology barrier for clinicians to overcome in order to use it. However, as an embedded web app, Medloom is impossible to demonstrate without being integrated with someone's EMR system. For that reason, we built a data portal that allows us to demonstrate Medloom's capabilities outside of the framework of an EMR interface. This video is provided to give you an appreciation of the power of Medloom that is normally something that can only be appreciated after it has been bolted onto an EMR system. Again, in the normal situation, no one would be hand-entering data into a Medloom data portal. All of the analyses you are about to see would be happening automatically, behind the scenes, whenever a patient record was opened by a clinician using their existing EMR system. When I log into this portal, I am taken to a page that offers me choices. These choices reflect the 3 primary functions supported by Medloom's integrated, advanced artificial intelligence analytics engine. The early warning system allows me to screen a patient medical profile to see if they might be at risk for a serious and costly clinical outcome based on the information already in their medical record. The adverse event system would be a function of value to a physician in the emergency department who sees patients already complaining of some symptom, or even in an outpatient setting in which a patient has been scheduled for an appointment because of a complaint. Medloom assumes nothing and treats all new complaints, whether in the ED or the outpatient setting, as potential adverse drug events. The Advanced Drug Utilization Review, or DUR tool, is ideally used at the pharmacy or PBM level, allowing the pharmacy director to vet a script through Medloom as a last line of defense or safety gateway beyond all other drug interaction reference systems to prevent actions that are discovered from real-world analysis to result in bad outcomes, whether or not those drug interactions have been published yet in drug labels. The first function I'll run through is Medloom's early warning system. In this case, I'll enter the medical record information about a 45-year-old female who is being treated for breast cancer with 3 medications, cyclophosphamide, fluorouracil, and Herceptin, or trastuzumab. In the commercial setting, none of this information would need to be entered by hand, as the information in those discrete data fields would be automatically captured by Medloom, whether that information was codified by ICD-9s, CPT-4s, or drug codes, or simply entered by description. When I click on Search on the data portal, Medloom instantly searches through its entire cloud of AI-driven discoveries of adverse event risk profiles to see if this patient is a match to any of them. What we find is that Medloom has not only found that this woman is at risk for developing cardiomyopathy, she is at Medloom's highest level of risk, which is a red level warning. What that means is that everything about this woman's medical profile matches a pattern discovered by Medloom after an AI-based analysis of millions of real-world case reports to define the kind of patient that is likely to experience this adverse event in the real world. Not only do her medications match the pattern Medloom discovered, but also her age, her gender, and even her background conditions and symptoms. If everything about this patient had not matched the entire risk pattern discovered by Medloom, a red level alert would not have been presented. Think of a red alert as a tornado warning for your house, as opposed to a tornado warning for your entire state. The former is something you really need to pay attention to, while following every alert that pertains to a statewide area will only serve to jade you to those alerts. Sound familiar? Let me show you what I mean by going back and changing something. For instance, if the patient did not have a background of breast cancer, but maybe a different kind of cancer, or if I simply did not know her background conditions and symptoms and only had access to her age, gender, and meds list, then a search of Medloom's cloud for risk patterns would only be looking for matches between demographic information and meds. And while the result still would have been a risk alert for the development of cardiomyopathy, the alert level would have been downgraded to an orange alert, indicating that the alert may be less relevant to the patient in question. Some hospital pharmacies may choose to receive only red level alerts from Medloom, while others may leave the decision of relevance to the pharmacy director. In the emergency department, everyone who comes in already has a problem. Medloom automatically assumes that any emergent problem may be an adverse drug event when there are meds listed in a patient medical profile. If Medloom were already embedded in the ED's EMR system, then whenever the ED doc opens up a particular patient's EMR, the only information the doc would normally enter is the name or code of the complaint. From there, Medloom would automatically include that complaint as a potential adverse drug event with the rest of the patient's medical profile and send a query to the cloud to see if that patient's complaint matches any of the patterns discovered by Medloom in an AI-based analysis of real-world data. In this case, let us assume that a 51-year-old female has presented in the ED with myotonia. Myotonia is a symptom of neuromuscular disorders that characterized by the slow relaxation of the muscles after voluntary contraction. The patient has an active diagnosis of neuralgia, or nerve pain, and has been treated with the GABA-based nerve pain drug Neurontin, as well as having just gone through surgery for her nerve pain, where she was treated with the general anesthetic agent called sevoflurane. The only thing the ED doc has to enter is that the patient presented with myotonia, and Medloom takes it from there to see if the patient's medical profile matches any significant associations with myotonia in Medloom's cloud of AI-driven discoveries. And sure enough, Medloom finds that a red level warning comes back for patients like this one to develop myotonia. It's a red level warning because everything about this patient matches the pattern Medloom has discovered in the real world. Not only both of their meds, but their age and gender, as well as their background condition of neuralgia. There's nothing the ED doc can do about the patient's age, gender, or existing condition, but the patient's meds may be something to look at. So if we go back, then the ED doc could run a what-if scenario by looking into replacing Neurontin with another GABA-based nerve pain drug called Lyrica, for instance. Then, when a safety check is done, Medloom looks for patterns in the cloud that match this patient's profile, including Lyrica instead of Neurontin. And in this case, there is no match to any danger signals in the real world. That's a safety check that's worthwhile because in this case, the drug interaction of Neurontin with the anesthetic agent sevoflurane towards the development of myotonia was only published last year, whereas Medloom picked up a significant association linking this drug combination 4 years earlier. The last function I want to demonstrate is Medloom's use of artificial intelligence analytics to support really advanced drug utilization review, or DUR. Where this would be of most benefit would be in the pharmacy or at a PBM, where the pharmacy director can provide the most advanced patient safety gateway in the world and still provide that support at the point of care in real time and using real-world data. In this case, let us assume that a 65-year-old man has a background of renal insufficiency and anemia. He is taking Lasix for his renal insufficiency, and the pharmacist has received a prescription for Procrit, or epoetin alpha, for the man's anemia. A quick check by the pharmacy director tells the pharmacist that in patients exactly like this one, there is a likelihood of developing red cell aplasia. Pure red cell aplasia, or PRCA, is an even more profound anemic condition than what the patient is being treated for. In fact, everything about this patient aligns with the pattern Medloom discovered as being significantly associated with the development of red cell aplasia. But with Medloom plugged into the CPOE, or pharmacy database, we're able to take action before the fact. Here, the pharmacist can go back and try something else. In this case, if the pharmacist replaces Procrit with an iron-supplemented multivitamin or even a transfusion and reruns the query, there's no warning found. What we're working on now at LeadHorse is upgrading Medloom to automatically run the therapeutic equivalents of any drug involved in a red level warning that links a drug or a drug combination to a life-threatening adverse event. Doing so will mean that the pharmacy director won't have to run the therapeutic equivalents in a second query. If Medloom discovers a red level warning with what's been ordered, it will return not only that warning, but the results of queries run using the therapeutic equivalents. That's an automated process that provides not only insight into real-world dangers, but alternatives for clinicians to consider without adding unnecessary tasks and time to their already busy schedules. That makes Medloom not only an advanced drug safety tool, but one that cuts costs and makes life simpler for clinicians. That's Medloom in action. For more information, see more explanatory videos at www.leadhorsetech.com or give us a call at 1-888-MEDLOOM. Thank you.